Good afternoon, everybody. Welcome to our session this afternoon on using racial justice lens to advance health equity. Thanks for joining us for this important conversation. We're really grateful and thrilled to have Jackie Doan from the Massachusetts Department of Public Health with us this afternoon. We started talking, Steph and Rena and I started talking, earlier this summer about how we could address this issue of racism and health equity among the network and within the network. And Steph graciously jumped at the chance to share her expertise and that of her colleagues. And so she reached out to her colleague, Jackie, as Jackie has been a long-time advocate for racial justice and how it impacts health equity in Massachusetts, particularly with tobacco and the tobacco companies. And so we're thrilled to have Jackie with us today. Just as a preface, so most of us on the call are with the National Network of State Adolescent Health Coordinators, and I know there's some community folks joining us, so welcome to all of you as well. I'm Lynn Brettel, the director of the State Adolescent Health Resource Center at the University of Minnesota. And so Jackie's going to give a presentation, and I'm guessing we'll have some time for conversation, questions and answers throughout. You can feel free to share in the chat box. And we are recording the session today. Several folks were hoping to join and are not able to, so we always like to record so we're able to share afterwards. So just a heads up for folks that we are recording the presentation. So without further ado, let me introduce Jackie to the group. She is the manager of community programs for the Massachusetts Tobacco Cessation and Prevention Program at the Massachusetts Department of Public Health. She has spent the last decade fighting injustices caused by the tobacco industry at the local and state levels, specializing in community mobilization, program management, and development. Jackie believes that young people have the power, knowledge, and skills to lead change in their communities, and that youth are not subject to change, they are the catalysts for change. She centers these values in her role of overseeing and growing Massachusetts youth tobacco programming. Jackie, thank you so much for joining us today.
Hi, everyone. Thank you for having me and for that welcome. I feel like there's a few opportunities for states to connect at this level with our peers around youth health, and so I'm just really grateful for this invitation and getting to hear from you all and learn together today. So for today, before I dive in, wanted to just see who's in the room. If you want to, in the chat box, share your name, pronouns if you wish, your state, where you're from, geography, or your program represents, and maybe one word to describe how you're feeling right now. So gauge the energy. I'll give us a few minutes to do that. Great, so we have some feelings of gratefulness, gratitude, curiosity, tired eyes. If you want to turn your cameras off for this, my hope is that we'll have a discussion a little bit later, but take whatever. I know we're all Zooming a lot. Do what you need to do. Hungry. Okay, great. Thank you. Idaho, Tennessee, great. So we have a good representation here. I'm gonna invite you all to continue chatting and sharing your energy with each other. And I'm going to dive in here. So just for some context for my role at MTCP, our tobacco program in the department has a bunch of programs, whether municipal health departments, community mobilizing agencies, and one youth program. So unlike maybe some of how you all are structured, I'm the lone wolf in our tobacco program with our youth program, even though it is a very substantial program and it is statewide, and you'll get to hear more about the 84 in just a minute. So for my hopes for today is that perhaps you maybe were on Steph and Beth's presentation, I think last week or so, but I'm just gonna dust off, in case you missed it, some of the framework and shared definitions of the components that we're utilizing in our journey, which I'll get into next, to integrate a Leading with Race and Racism framework, what that has actually meant for some programmatic shifts, specifically around our youth programming. And then, as I said, really looking forward to learning and growing with you all and hearing about ways that this has shown up for you in your roles, and how we can think about our advancing of equity. One brief but important disclaimer to make is that in this presentation today, I'm going to be referring to commercial tobacco, not the sacred and traditional use of tobacco by some American Indian communities. So if you're not familiar with the two, traditional and commercial tobacco are different in the way that they're planted, grown, harvested, prepared, and used. With traditional tobacco has been used in sacred ways by American Indians for centuries, and its use differs by tribes. But for today, we're talking about commercial tobacco, which are the products that you see here on the right of your screen, with things like vaping, snus, e-juices, blunt wraps, cigars, all of those being commercial tobacco, which are grown by tobacco industry. And I'm just going to ask Rena, or Lynn, if you could just help me monitor the chat. I think people are still kind of chiming in, it looks like, and looking at this, but please feel free to pop in with any questions if anyone has them, or to unmute yourself as we go. That would be great. And I can't see anyone's faces, so I'm just going to assume we have a thumbs up here. The other acknowledgement that I want to make here is that while it brings me so much joy and energy to share the work of Massachusetts youth today, it's really, I'm just representing their story, and I wanted to acknowledge both the statewide leadership team, which you might hear me refer to as the SLT, which is our advisory group, if you will, for the state. They help us make programmatic decisions and co-facilitate trainings. They help with hiring for our vendors, and they really serve as ambassadors to represent the program throughout the state. And a lot of credit is due to them, as well as our vendor, Health Resources in Action. They are the ones that hold the contract with us and actually implement the programming with young people and in communities, and are just really amazing partners in helping to manage the work. So another question I want to take a little time out here to hear from you all about is, if you had to categorize either your agency or organization, or even for yourself, however it makes sense for you to respond, where are you all in terms of addressing and acknowledging and integrating racial equity into your work? So in the chat box, again, and pulling up the chat box here, sorry for the awkward delays, if you had to kind of narrow it down to 1, 2, 3, 4, where are you all at? That will help me know too how much time to spend. I hear you, Ryan. It's hard to feel like a 1 all the time. Great, cool. 4, 3, 1, 2, 1 and 2. At an introduction level. 1 for health equity, 3 for racial. Okay. All right. So it seems like we're all on a journey, or most of us, and some of us are agencies might not be considering it, but this is great. Okay. Okay. Excellent. I will defer back to that in just a moment as you all continue to chime in. So I'm going to start with the why lead with race and racism framework for us. So this is not intended to be a training by any means, although we can connect to some amazing resources. But I wanted to make sure to kind of highlight and give us some shared definitions for today together about how we've been thinking about this framework and our definitions. So at the very kind of basics of it all, diversity, meaning things like variety, equality, being sameness, and equity. This is really where our focus is, looking at fairness and justice. And so I know these are really simplified ways to think of these terms, but they're really important that we distinguish the differences. And in terms of racism, there's 4 levels that we have adopted in our practices, in both 2 at micro, 2 at macro. So, and I'm gonna, I know this was part of previous presentations, so I'm gonna simplify this, and if there's questions, please pop them in. But so think about the micro level, internalized, that is within individual people, a set of private beliefs, prejudices, ideas, biases about race and racism influenced by our culture. So this shows up in things like entitlement, or not feeling as qualified for something, or belonging, all centered around being a certain race. Interpersonal is the more of expression of racism between 2 individuals. So this shows up in things like jokes about race, or slurs, or hate crimes, or racial violence. And then at the macro level, there's institutional, looking at the discriminatory treatment and unfair policies and practices, and inequitable impacts and opportunities within organizations and institutions. So thinking things like schools and educational systems, companies, media, based on race. So this shows up in things like hiring practices, profiling, school suspensions, who's looked up as high achievers, institutional. Then finally, structural, racial bias across institutions and society over time. So this is the cumulative and compounded effect of an array of factors, such as policies and institutional practices and norms that work in various and often reinforcing ways to perpetuate inequities. And this includes things like minimum sentencing or neighborhood segregation. And for our purposes in this work, we're really focused on macro level interventions, if you will. Yet it's hard to, I don't mean to undermine the also important significance of addressing micro level too. But you'll hear us talking today about interventions centered on upstream root causes of racism. So those are the levels, and then I started to get into groundwater. So part of our work with the Racial Equity Institute and the training that a lot of us have done internally, which again, I'll get into the infrastructure and capacity and more about this training in a minute. But this groundwater approach is really a helpful metaphor to conceptualize these structures and environments and to think about root causes of health inequities. And so really going to paraphrase here the whole concept, but encourage you to go download the full text of it at this link at a later time. It's really a big core of the work that we've been doing. So the idea is, if you looked out at a lake and saw one fish belly up and wanted to see what caused that fish to die, you would check the fish, the individual fish, and public health might say like something about the behaviors, or maybe that fish was at risk, quote unquote. But if you looked out to a lake and saw multiple fish belly up, you would think to check the lake, what's going on in that water, or what's going on in that zip code for a parallel, and try to understand the patterns that are leading to a certain fish to die in this lake. And then if you looked across multiple lakes though and saw multiple fish belly up and dead across the lakes, you would think, what connects these lakes? And this is the idea of groundwater, these kind of foundational systemic things that are connecting us all and leading to poor health outcomes. And so it's not enough to heal or fix the fish alone, or even the lake water, right? We need to really be thinking upstream and address these systemic root causes. This amazing document goes on to highlight the inequities shown and why leading with race and racism framework is important. So we can see, sorry, one second. We can see that racial inequities exist across institutions. So while our focus is on public health and my focus on tobacco specifically, we see that these exist across systems, again, in these institutions that we previously mentioned, like schools, like housing, health, education, and so on. And so for us, looking at why we lead with race, we're saying we're leading with race explicitly, but not exclusively. This is a framework for us to get to health equity and to acknowledge that most people live within intersectionalities and that there's inequities seen across identities, but this leading with race and racism framework is a way for us to address systemic oppression at large, starting with the racial inequities. Second, race is a primary indicator of one's health status. So race, which is a social construct not rooted in any scientific genetic basis, race alone should not be a predictor of one's health outcomes. And as noted, it's seen across systems and as seen in the last graph that I know I breezed by. And then finally, other forms of identity or status alone don't explain these inequities. So regardless of income, gender, sexual orientation, when we adjust for other identities, we still see inequities by race alone. So what does that mean for tobacco? For us, for understanding the historical context is really critical to identifying the systems and structures that have led to and are perpetuating inequities, and what structures of the past and present are really feeding them. And when we look at tobacco, we see that the industry has really leveraged and exploited racist policies and practices, from the colonization of this country and the land where tobacco, the sacred plant and medicine that I had noted of traditional tobacco, became a cash crop, was commercialized, mass produced, and then the industry going on to leverage policies like segregation and redlining and targeting communities of color. And we have years of documents and evidence of this by the tobacco industry. And so understanding this historical context is important. And I want to specifically highlight menthol. So we'll talk about this a little bit later too, about the policies around menthol. We have quote after quote from the tobacco industry noting their tactics to target communities of color, homeless populations, young people with menthol products. And the tobacco industry especially was one of the first industries to really, feature communities of color in advertising and deceitfully engage and invest in communities. And even as recent as 2009, when federal laws were passed to restrict flavored cigarettes based on these documents that were revealed showing targeting, menthol was not included. And so we have published, even just as early as last year, continued articles, peer-reviewed articles showing continued targeting by the industry with things like pricing discrepancies in Boston by census block, which is another tactic the industry has used. So the industry has really capitalized on racism, and this is just a snapshot of the history. We have a whole other presentation all around the history of it, and there is a documentary too online that I'll share a little bit later if you're interested in learning more about that. But there's so much to cover that I'm skimming through. So for data, so what does that mean? How we look at data is another component to understand the history, the context, and then disaggregating by race to see and understand how the current and historical policies explain these inequities. And so you can see for Massachusetts here in this graph, when we disaggregate by data, disaggregate the data, you can see that for white people compared to people of color, the successful quit attempts of smoking are lower. And that is also, as I had mentioned previously, not by coincidence, that is by tobacco industry design. They have specifically targeted and placed tobacco in these communities, along with many other things like systemic bias in the healthcare industry too. So we often get asked to look at, what about other identities, as I had mentioned before. And when we look at the data, we can break it out here too and see that this is true by income, successful quit attempts across the board. And I don't know if you can see my arrow to see where I'm pointing. But the point being, the graph speaks for itself really, that despite income, we still see less successful quit rates among adults. And so the goal isn't to just close the gap, right? So going back to this graph here, it's not enough to just close the gap in these graphs or to try to create equal health outcomes, because white people are not doing well either. And in a nation where basic health indicators like life expectancy and infant mortality rank significantly poorer than other countries, despite our significant and substantial spending on healthcare, it's not enough just to close these gaps, where no one is faring well in this data. And so using a Leading with Race and Racism framework is a means for us to understand the root causes and address and lead to health equity for all. So what does that mean? That's a lot. And it sounds like you all are, based on how most of you responded to the poll question, are thinking what's in your work too. And there's a lot of steps and parts to the story. Today, I'm going to focus on what that has meant for us in terms of capacity building and infrastructure, data, as I kind of highlighted a little bit today too, and then putting it into practice and operationalizing. And to be clear, this is not linear by any means. I've tried to structure it in a way that is digestible, but it's not, this work is not as linear as it may present right now. So here are some of the components under those buckets that I had noted. Looking at infrastructure, we, as I had mentioned, the Groundwater Training and the Racial Equity Institute have been really helpful in us getting a shared framework and definitions and building a foundation for equity across our programs. And so now I'm talking still internally with MTCP, and I'll get to the youth program in a moment too. And normalizing conversations around race, having the relationships, the heart space, the trust relationships to engage in this work together, and really building a learning environment. So things like affinity groups, having these trainings available for staff, continued conversations and growth. Another kind of large bucket area that we focused on is data collection, analysis, and framing. Again, there's a whole nother presentation on this. If there's any EPIs in the room, I'm happy to connect you with our EPI too, and to share kind of this whole framework that they have used to disaggregate, analyze, and understand and interpret the data. So for example, in the previous example that I had given around successful quit rates, what we had seen for a long time is that rates of prevalence is the same across races, but the successful quit attempts is different. So if we only focus on prevalence or one identity, we're not really able to understand the inequities. And again, as I mentioned, historical context, as well as community voice and framing data with the structural analysis. So thinking about data in a different way, we often look at our BRFIS or YRBS, and those are really great, like bulk hard data points. But contextualizing that with the community voice, understanding how data is lived out is important in how it's presented. Next, operationalizing and implementing. So internal policies, practices, looking at performance reviews, our hiring processes, procurements. We have work groups that are within our bureau that are and in our department that are looking at our structures and policies around these for our CDC and federal work plans, making sure we have intentionality, and again, the learning environment and having contracts and capacity building and support in TA. And I'm just noticing the time, so I'm gonna like speed up a little bit here. So what we did was we took this internal infrastructure that we have and we replicated it with our programs and our vendors. And so this is kind of a model that showcases a process of normalizing, operationalizing, and organizing, as I had mentioned, around normalizing the conversations, operationalizing tools and resources, and then mobilizing. So how did that translate to youth programming? Again, I'm going to focus on those same buckets to see kind of in an attempt to showcase the linearness that isn't. But for the 84 itself, just a quick background. These are kind of the 3 pillars of our programming, focusing on elevating youth voice, fostering civic engagement, and leadership development. And so really the 84 works to support youth in fighting the influence of the tobacco industry in their communities using these buckets. And we have one statewide vendor that provides capacity building to what we call quote unquote chapters across the state that are all come together for their movement and all do work in their communities. So for the 84, what this meant for the program was mirroring, again, that kind of process that we took both internally and with our programs and vendors. So working with young people to have shared definitions and foundation of this work together, normalizing conversations, looking at the history and the context. So you'll see here is an example of an activity that young people came up with to show historically these touch points of tobacco in history over time, along with other significant moments in history related to race and racism, and seeing how these parallels between industry response to significant policy changes in our country over time correlate, and understanding how the past history and the current allows inequities to continue. The other component, looking at the data, I hope I'm not glitchy for you all. The other components, looking at data analysis for both health outcomes and for programmatic evaluation, understanding how things like YRBS data is actually lived out and how youth interpret the data before we define it, having a shared definition of what the quote unquote issue is. It also, in terms of programmatically, working with young people to take the data and translate it into programming and understanding the impact of our programming. So this has played out in different ways for us in terms of things like supplementing data. We've worked with young people to develop samples and to administer surveys and then gather, analyze, and disseminate, and then use to inform action planning. So you can see one example of some data outcomes here on the screen. We have our YRBS data. We know based on other data nationally that youth use flavored tobacco products, and the tobacco industry has targeted youth with flavored products, and as a result, they are used, but we didn't have menthol specific data, and we, after getting to understand and hear the concerns and know about menthol and its deliberate targeting to communities of color, we wanted to understand, our youth wanted to understand, what does that mean in their community? So they worked to develop, we worked to develop a survey with them to administer and get samples to understand for each community what that looks like, and again, disaggregated by race. In terms of what that means now that there's shared data, shared definitions, how do we operationalize that? What do we do? What do we programmatically implement as a result of that? And another activity was the youth wanting to hold community conversations, and also, again, normalizing the conversation in communities and working to mobilize really around menthol policies is how this began. And so young people held community conversations, both with community members as well as with stakeholders and policymakers to explain the historical and current injustices around menthol. So I had mentioned local policy, the community conversations. The other component that recently had happened was just hearing from young people and trying to read the room. And once so menthol, I should actually, let me back up here. For menthol, that work did start largely locally with young people and passing policies in their municipalities. Now the state of Massachusetts does have a statewide restriction on both flavored tobacco and menthol, and that is, and largely credit was due, even though young people were not advocating for policy at the state level, their work on the community level and their conversations with state legislators helped inform and demonstrate the issues that they saw in their communities, and legislators took action. And while the bill was actually being heard on the floor, legislators talked about the impact of the stories of young people. And so having those conversations was really important to the overall statewide effort, even if not in the formal advocacy or traditional advocacy sense of the word. And the other point I wanted to mention was just about COVID projects. So once once COVID began, I'm trying to even think of the timeline here in my head. This was back in, I think in January, we had planned to have a mini grant, like a project activity. And then once it was set to be released, we were in just a different world with COVID. And so we, instead of promoting the new law and raising awareness around that, we really looked to understand from both the young people and adults that we were able to still connect with about what are their greatest concerns during this time, and how should we shift programming. And we heard a lot about feedback about centered around mental health concerns, isolation, housing, income stability. And so we took that feedback and tried to figure out with like protective factors and other things that we could tie to tobacco, and as well as our pillars of promoting youth voice and increasing civic engagement and community connectedness, and set up projects that aim to address social determinants of health and things like social context, community context, built environment, education, and just overall, community health, and drew that connection so that way young people wouldn't have to lead with tobacco when that wasn't the priority that they were seeing or hearing. And so what ended up happening was some examples of projects included hosting virtual town halls and holding community conversations around racial inequities, including racial inequities around COVID. So having that infrastructure, having that understanding of inequities in communities was already established and was able to be translated to their understanding of COVID. Some groups did things like peer mentoring and as a means to prevent social isolation, and also they found ways to integrate tobacco, which was not our again, not our intended priority for this, but it did seem to dovetail. So we're looking to figure out more about what that looks like going forward. Yes, okay. Sorry. I'm just, sorry. I'm having technical woes. Okay. So the other thing that I wanted to mention, particularly because I feel like this is a unique space, as I had mentioned before, I don't feel like there's many spaces where we all get to come together in our kind of shared roles here to talk about what this looks like. And for me, this has also meant some, changing how we work in relation with vendors and examining the role of government programs, examining the role of myself, and the shifts. We talked about the programmatic shifts, but there was also this need to really rethink and transform our relationship, and that's where this heart space, we talk about the head and the heart in this work. And so, one way I've tried to think about this is, looking at again, acknowledging the role that we have had as a government program in perpetuating inequities and how that shows up in our relationship with vendors and in our internal culture too. But so for the vendor, what this, in that relationship, we had a really candid conversation and have been working on our relationship and thinking about that dynamic and a means to really meaningfully work together and come together and evolve this work and shift our culture and grow together. So what that has actually looked like, and these, I realize these aren't totally profound, but they're important. But thinking from this kind of mentality of contract compliance and deliverables and, meeting scopes to thinking about shared accountability, and that we too have a role in supporting and committing to the success of this work. So instead of, why in reporting didn't you meet these deliverables, or, it's more, were these expectations reasonable? Did we give you adequate resources to retain staff, to engage young people? What do you need from us to be successful in this? And making sure we understand our role in meeting outcomes. Things like quality metrics to transformation metrics. So instead of, of course, we still capture a number of youth engaged and things like that, but also hearing about how many youth actually made decisions, how many youth were meaningfully engaged, not just how many youth were reached or how much knowledge was gained, but also how much knowledge did we gain every time we connect with young people is an opportunity for us to learn and understand too. Again, the funder versus vendor relationship to more of the partnership approach. So acknowledging that power dynamic, and also honoring the value and power of vendors to do this work. And again, our shared accountability. Approvals. How many of you have approvals? One thing that we reflected on too was there's just, across programs and internally, just a lot of approvals, and shifting that to shared decision-making, doing some decision-making mapping and having a collective voice. And when I submitted this presentation today for approvals internally, I also submitted it to our vendor to make sure we really are representing the work and it's not just my narrative. And then thinking even just like work plan development, moving from we know what's best, the evidence base, here's what the CDC says we have to do, to really acknowledging the power that we have to influence and develop strategies, and that bringing in both the vendor and the youth voice and creating work plans and in reporting. Okay, so some kind of lessons learned and opportunities. It takes time. It takes a lot of time. When this first started, we hired a consultant. We decided to embark on this whole retool process, and we were ready to just like throw away the infrastructure if it didn't work. And really, transformation just looks different than that for us anyway. And then affinity spaces for youth. So that's one thing too. We had talked about how we had replicated with a lot of our programs the work that we had done internally. Some of our community mobilizing and municipal programs and other vendors are doing affinity groups right now. And we are trying to figure out what that looks like for youth as well, acknowledging the role and need for that space with young people. From trainings to workshops, as I had mentioned before, looking at, instead of having this kind of lens of imparting information and building skills of young people to, really us learning with young people. And again, these things might just sound benign as I'm saying them out loud, but they're really important shifts. And then capacity changes with the environment, and that means expectations have to change too. And finally, the continued conversation about intersectional approaches. So we can have this great law in Massachusetts, and we can be the #1, healthiest state, and all those things. But if you, look at our communities, work with our communities, and see the outcomes where, we have a lot of work to do, and thinking about it from this, approach of either tobacco or vaping or, or violence prevention, and these, we can succeed in our own content areas, but truly fail from a public health perspective and from a youth perspective. And so I know Steph and I have been scheming about what that looks like and where that intersectionality is, and how, we're all really funding a lot of the same agencies in our state, yet to do different things, and yet we're all talking about the same systemic causes of these inequities. And so how do we transform that too is hopefully the future. So I realized that I skimmed through that so quick. I'm gonna stop sharing because I think that is the end of my slides, and I want to put my camera back on and check the chat here. Okay, so, and we have a good 15 minutes. What questions do you have before I dive into my questions?
One question I have, Jackie, is as you went through this process, what advice would you have given yourself at the beginning that you know now in terms of applying a racial equity approach in such a large institution?
Yeah, I mean, I guess, I heard we had our CDC kickoff meeting the other week for our grant, and one thing that one of the speakers said was move at the speed of equity. It just really stood with me. There's this sense of urgency to do and address and like overcome, yet that really undermines the need for authentic relationships and intentionality. And so kind of finding some balance there, I think, was hard for a long time. And that's like so much of this work, I guess, is if I could tell myself 5 years ago that.
Jackie, I appreciated how you shared several, concrete action steps that those of us who work in public health structures, as opposed to working directly, with young people or communities can do. So I think that that's really helpful. And I appreciated how, you mentioned several strategies, and that there's like parallel tracks, that while we're doing our own work internally, there's also outward external work we can be doing as well. So I don't really have a question. I just wanted to thank you for sharing several things that we can be working on and doing at the same time. And after listening to your presentation last week as well, Steph, it really sounds like internally in Massachusetts, you do have some clear action steps that you're all taking. There's similar language, and it seems like you've worked hard to have some level of shared understanding of how you're working as a department or in an institution. So that seems to be something that, we could all be striving for as well, if we're looking for a place to start.
Yeah, I think, Lynn, it's actually a little step smaller. I would say it's our bureau who's really working to create a shared language, because it's integrated into our bureau-wide meetings. We have individual work happening in teams. And so I can't really speak, and Jackie, feel free if you disagree, like outside of BCHAP and BFAN, that there's like a shared language where we don't have to start from the beginning.
Yeah, I would agree with that. I mean, it's like every revelation is like a new, like every growth is like a, you know, I know I skimmed over that figure, but I feel like we're just constantly cycling and like normalizing conversations and normalizing white supremacy culture, or the conversations around it, hopefully not normalizing it, but yeah. And so it's, yeah. And I think one other thing too, to your point, Lynn, I think even if your agency isn't committed to this, like we all hold some power and influence. And so the work, you know, we don't need to wait for leadership or for our work to move forward.
Mm-hmm. Steph and Jackie, do you have recommendations? I think there's maybe two ways to go about this, but, you know, doing internal affinity groups or, you know, learning communities just internally for all of us to figure out our own racism and, you know, doing our own personal education about that, particularly for white people. Do you suggest, or how have you done it in Massachusetts, mixed interracial groups, or is it, have you found it to be when it's like a group just for white people, a group for people of color? How have you all done it, or what would you recommend?
I can. Oh.
You go first, and then I'll piggyback off of, since we just kind of had an affinity meeting yesterday.
Yeah. Yeah. I would say in terms of the, we initially, when it had started, the groups had started, the first and last groups in mixed race space. And I think a lot has happened too internally as well. Like we have different groups, whether it's, you know, we have white spaces, and then we have different groups for people of color by identity, and for LGBTQ, and for men of color. And so there's a lot of, unique groups for us, for the white space groups. I can share, we have, we just kind of start off the beginning of the sessions with like, why are you all here? What do you want to get out of this kind of thing, and try to frame the conversations around that. And just to have facilitators, we don't have trainers, again, you know, where they hold the conversations. We also, in the tobacco program, have been using the Me and White Supremacy book by Layla Assad to, you know, visit each chapter, which is a very tangible thing if you don't feel like you have the capacity to create, or, you know, or relationships to construct something, or whatever that looks like. But that's another avenue that we've taken. What would you add to that question?
Yeah, I think we've learned a lot with Affinity. And so, as Jackie mentioned, we initially started with a mixed race group where the first and last session were mixed race, and then we went into white and POC. Since then, and POC is people of color. Since then, what we have found, and particularly among the people of color group, there's so many interracial dynamics between the different racial groups, we needed more space. And so we have a Black affinity, we have the Asian Pacific Islander affinity, we have the LGBTQ affinity, we have many of them. And where we currently are in our process is, yesterday we met to talk about, we recognized that we had these multiple groups because we also did not want to cause any harm to each other while learning. Because we're also colleagues, and if you are in a learning space and someone's harmed and you have to go to a meeting, that's very problematic. And so that was part of why we kind of took a step back. We're now in the beginning stages of trying to bring all of our affinity groups together to figure out, like, what does allyship look like across the continuum from being an ally to a co-conspirator? How do we make sure affinity groups really get to the goal of solidarity and liberation, although we've taken a step back for our individual learnings? I feel like it's definitely one of the things Jackie alluded to, like, we're not on a linear journey here. We had made many mistakes and went around and went back to the starting point, but just trying to not cause more harm to any of us as we're trying to create a more racially equitable internal culture in particular.
Thank you. That's helpful.
And it's all volunteer. I think we should say that too.
Mm.
It's not a mandate in our department. It is opt-in.
Okay.
Anyone else have any questions or any stories of how things that maybe I didn't touch on in terms of engaging young people in this work, or speaking of affinity, any affinity stories with young people? There's a lot of ones in the chat.
What I was thinking of, Jackie, when you were talking about, affinity groups among young people, or about how the young people you were working with created shared terms and norms, or normalizing the conversation, is that there's, of course, always something so wonderful about how young people whittle things down to the basics. And that doesn't mean simple, but they just cut right to the truth that as adults, we've learned to dance around and speak too carefully sometimes. So I think that was just a learning from thinking about that, about how young people are so much better at that than we are often as adults, and that can be the real value that they add and what we lose by not including them.
Yeah, I feel like I probably did that in this presentation, right? And so I think, and it's not, I feel like normalize is a, like the conversations, it's not like it's a normal conversation for young people when you have it with them too, right? But it's like the context that gets normalized too, to understand how they're, the structural component of it is what we've heard most from young people, like understanding it in the context. Not that racism is not a normalized conversation in their world. Anybody have any shared programming of like this kind of intersectionality? Like internally, do you all work with other, like a tobacco program or like other youth programs to, like, have you all figured out that structure to have like coordinated youth programming? Don't laugh at me, Steph.
I'm not sure if this answers your question. I'm located in New Jersey. I work for a nonprofit. I work for a tobacco grant. It's called Moms Quick Connection for Families. The idea is to help parents or caregivers that are current smokers receive resources and counseling for free to quit smoking. Generally, those families are families of color. And then New Jersey also has one of the worst preterm birth and infant/maternal fatality rates. So we also work using our tobacco efforts to reduce that number. And then I also work with a prematurity prevention initiative, and a lot of our work is centered around making sure that Black mamas have their voice heard, and that just because of the color of their skin does not determine the quality of care that they receive. So I felt that this presentation was really appropriate because we do work with all kinds of families, but especially in New Jersey, those are typically the families that have the biggest disparities.
So do you feel like from your agency perspective, is that multiple grants centered around the same population, or multiple interventions? Just
both. So we have multiple grants and multiple interventions. The name of the organization is Southern New Jersey Perinatal Cooperative. So we have everything from tobacco intervention to sexual education to providing midwives. So the organization as a whole works with our community to ensure that important conversations are being had, and that the grants that we select are also meeting the communities that we serve.
Thank you. And we're already at time. I skimmed through it all and we're all like, oh, still at time.
It goes fast online.
It does go really fast. And I think you gave us so much to think about, Jackie, and for folks to, let simmer and then maybe come back to as a network, Steph, that, I think this is just the beginning of hopefully how we can have conversations about what we're doing internally with our organizations and how we can extend that programming to community partners. So it's just the beginning. But Jackie, thank you so much for sharing your expertise and your experience with us. We're so grateful that you were so eager and willing to do it. I know you have a full plate, and grateful that everyone was able to take this hour to be with us as well. So thank you. Thank you, Steph, for being here. And thanks everyone for joining us.
Thank you for having me.
Yeah, thank you.
Thanks, Jackie.
See you.
Be well.